Dr. Marcia of Move with Marcia, and let's answer the question, what is up with nerve pain? So you've heard words like carpal tunnel, sciatica, and the like, disc pain, I slipped a disc, whatever, and you're like, is that me? Is that what's happening? Or maybe you know what's happening and you just have some questions about it. Let's dig into it. What is nerve pain? First of all, it is the signal your nerve is giving from your body part to your brain that the nerve is impinged, overstretched, stuck, angry, damaged, anything like that, right? So that's the pain signal that you're getting. Why would you be getting that signal? Could have been some trauma. Maybe it was a trip, a fall, an accident, a cut, a crushing event, anything like that. Or maybe you have some sort of inflammatory process going on in your whole body, not just from an accident in one spot. Maybe you have something like multiple sclerosis or any other autoimmune condition, pregnancy even. That can also cause full body inflammation, which would impinge on your nerves. Or maybe it is a local problem, more of an orthopedic cause. So we're saying you're at your desk all day, slouching, whatever, or maybe you work with your hands, you're a mechanic, you're always twisting, overuse injury, that sort of thing. So that's kind of the different things that can cause nerve pain. What would it feel like? It could feel like different things. It could feel like tingling. It could feel like your hand fell asleep. It could feel like somebody's running ice water or hot water down your veins. Essentially, it is a sensation that is not normal, not necessarily, doesn't have to be in response to you touching something and it feels painful. That is something, allodynia, that's something else, we're not talking about that right now, but you're just sitting, minding your business, and you feel shocks, pins, needles, cold, hot, weird, right? That's nerve pain. So that can be pretty much anywhere in your body depending on the cause. So if you feel it along your face, along your jaw, or maybe in your fingers, by your elbow, back of your leg, it could be a lot of different places. And it also could be a lot of different causes. As I mentioned, there's a couple of reasons why you might have nerve pain. And that is why a physical therapist would be the person to go to help you figure it out. Because they can help you figure out, is this a part of a disease process I have going on, my chronic illness, whatever? Is this a side effect of my pregnancy? What can I do to manage it? So if your nerve is impinged or stuck, what can I do to move it? What can I do to open up that space? What can I do to make the surrounding structures a little stronger, a little looser? A physical therapist can help you out with that. There are some types of nerve pain too that require some sleuthing. So for example, if you happen to have it in your hands, your thumb, that could be carpal tunnel, or that could be a disc at your neck. A physical therapist could help you run some tests, ask some questions, look at your body, move around with you, and figure out where the problem is. So hopefully that makes sense. A real quick rundown of what nerve pain is, what could cause nerve pain, what it might feel like, and who you need to see to help you figure it out. Of course, more than likely, a neurologist would be the person that is going to examine your nerve pain if it is something a little more serious, if it's something that doesn't resolve with quick PT, nerve glide, stretching, strengthening, right? If it's not just a quick orthopedic thoracic outlet syndrome and something a little more chronic, you might need a neurologist. Because they're the ones that can order some tests for you to further look at what's going on with the nerves, exactly when, where, how, and what, right? Hopefully you can find a good PT, a good neuro, one that listens to you, one that makes you feel heard, somebody that doesn't rush your appointment. That's a whole different battle. But hopefully in this moment, we at least answered some questions about nerve pain. Cool? Fantastic. So that's the rundown. If you have questions about nerve pain, nerve impingements, carpal tunnel, cubital tunnel, thoracic outlet, peripheral neuropathy, sciatica, whatever the like, that's what this comment section down below is for. Feel free to drop your questions down below. If you're the kind of person that does not like putting your stuff out there in a public forum, you can email me, you can DM me, or you can schedule a live consult if you want to sit down for a little bit and do some sleuthing together. Okay? Okay, great. I'll catch you on the flip side.